afternoon, everybody. Welcome to week 3 of our Parkinson Awareness Month video series. Thank you so much all for coming. We'll give everybody another few seconds to pop in here and we'll go ahead and get started. Another beautiful day in NorCal. Can't beat the weather here.
And the allergies.
Oh yeah, no kidding, right? All right, welcome everybody to our third in a series of webinars. The last one is next week. It's Wellness Within the Context of Illness with Dr. Eric Egley. Just a reminder that all the recordings and slides will be emailed after the final webinar. Just one big note, the big day of giving for the Sacramento region, the NorCal region is today until May 4th, it's open. If you're looking for the link, please go to our website. It's our big donation period and any funding is appreciated for all the programs and services that we do. We can't do this without you. So thank you so much for your help. And a little bit of housekeeping, just a reminder that you're all on mute. There's no cameras, we can't see you and we can't hear you. And if you'd like to ask a question at the end of the session, click the Q&A tab on the bottom of the Zoom screen and we'll answer the questions at the last 10 minutes of the session. Do a couple of intros here. Dr. Nick Thakur is a neurology specialist in Sacramento with over 25 years of experience in the medical field. He has extensive experience in neurodegenerative disorders and neuromuscular and movement disorders, and is currently the director of deep brain stimulation and movement disorder for Sutter Health. That's a lot. Nick received his DO from the Arizona College of Osteopathic Medicine, completed an internship at Mount Sinai Hospital in Queens, and his residency at the University of Texas Health Science Center. He's written numerous articles and speaks on his expertise as much as possible. Sabrina Burri is a Sacramento native. After achieving her BS in Physiology and Neuroscience at the University of California, San Diego, and Doctor of Physical Therapy at Duke University, she returned home, is now employed by Kaiser Permanente in Roseville. Sabrina is a neurologic physical therapist who works extensively with the Parkinson's population individually and group exercise settings, and has advanced Parkinson's exercise training certification. All right, I am going to stop my screen and I'm going to go ahead and turn it over to Dr. Thakur. Welcome, Dr. Thakur. Thank you.
Thank you so much. Yeah, it's my pleasure to be here in this webinar series honoring, Parkinson's Awareness Month. And we get to talk about one of my favorite topics is exercise. I mean, I've been quite active since being a kid, playing, lots of sports, and I have 2 boys playing, soccer, baseball, basketball. So I'm always running after them, trying to keep in shape because, it gets tougher with a 9 and 10-year-old. And so for sure, exercise super important in the treatment of Parkinson's disease. And so I try to instill that with all my patients, try to keep very active on a daily basis. We know that exercise helps, not only the motor symptoms, with stiffness, slowness, imbalance, but also the non-motor symptoms of depression, anxiety, problems with stress or memory. And so it's really, really important to have an exercise program, part of the treatment of Parkinson's. A lot of the research is indicating that, the progression of Parkinson's is potentially slower in people that are more active with these exercise programs. And definitely we see that with our patients in our clinical practice. Those that are most active do tend to do better overall. And so, it's really important to find a good program working either with a physical therapist, personal trainer. And, it's good to do a mixture of things. And, we'll probably hear more about that in the lecture. But doing stuff that involves endurance, either like walking or cycling, as well as, stretching type exercise, yoga, Tai Chi, anything that involves, agility. A lot of people like the Rock Steady boxing program, as well as, dance therapy. And so that really helps with balance and movement. And then lastly, strength training, resistance training has been helpful as well. So doing a mixture of things is super important and, trying to do that daily. The general recommendations is, about half hour, at least 5 days a week or so. And I try to tell my patients like a medication, exercise is like a medicine really. And it's been shown to do that, have the same effects as the Parkinson's pills on imaging. And so if you miss your meds, your symptoms will worsen. And same thing with exercise. And we hear that all the time. We go on vacation, we don't do anything, and then I feel a bit worse when I get back. And so clearly it's super important. And then lastly is finding something you enjoy. Because if you don't enjoy it, you're not going to do it. You may do it for a few weeks or a few months, and then you'll stop. And so enjoying the exercise is important, and working with like I said, a therapist or a trainer or a class. And so that kind of leads us into our lecture here, the fundamentals of joyful exercise. I think that's a great title. And yeah, it'll be interesting because clearly a lot of patients need that help in finding something that they want to do every day. So thank you. I'll let it back to you, Jan.
Awesome. I'm going to go ahead and turn it over to Sabrina. So Sabrina, are you ready?
Yes, let's get to it. And thank you, Dr. Thakur, because you set me up very, very nicely for my presentation.
Yeah, no
some
problem.
spoiler alerts in there for sure. So hopefully everyone enjoys the day. I am super excited to be giving this presentation on the fundamentals of joyful exercise as part of the first ever webinar series for PANC, and extra special that is the same month of Parkinson's Awareness Month, just getting to kind of honor that with more education and discussion and awareness. So I have lots of information jam-packed here today. We're going to hopefully take a few movement breaks to demonstrate some exercises that could be beneficial and showing you that it can be joyful and it can be fun. And then please feel free to have those questions towards the end, and I'm happy to answer anything that comes to mind. So getting started here, if my screen will move. I already got an introduction, but yes, I am a physical therapist, a neurologic physical therapist at Kaiser in Roseville. And fun fact, I actually was a student here first, and the first patient that I ever saw as a student had Parkinson's, and that totally got me hooked and invested in the profession. And I've been extremely dedicated to this population since. So I work with a very large population of Parkinson's, and it's a lot of fun. And I hope I get to convince you of that today too. So first question is, why should I exercise? And I want you to be so convinced by the end of this presentation and conversation here today. But I think a really kind of important note is that Parkinson's is a movement disorder where movements are off, they are abnormal. And so it just makes sense to treat it with movement. So with Parkinson's, we often have small movements. So we want to force big movements or movements that are slowed down, and then we go for fast movements, and can be a very beneficial reaction in the brain with exercise and movement to help kind of rewire and reinforce some of that circuitry. Just a few starter points on the benefits of exercise with Parkinson's. And this is definitely not comprehensive, but just some things to kind of consider. Definitely, there's been a lot of research that shows comparing those who exercise and those who do not, who have Parkinson's. Those who do exercise have a much higher quality of life. 2.5 hours out of the week kind of achieves that higher quality of life, which we'll dive a little bit deeper into. Slowing the progression of the disease, kind of having that neuroprotective effect to help the dopamine be a little bit more efficient, which with Parkinson's is a depletion of that dopamine. Improved cognition. We often have that sense of clarity after exercise with or without Parkinson's. And especially since there is that cognitive aspect oftenly found in patients with Parkinson's, this can be extremely beneficial. Improved mood. Depression, anxiety are very common reactions, but also experiences of the disease. And especially since you may have found that anxious thoughts or tendencies temporarily worsen the symptoms, it can be helpful for you to be in control in some way. Sleep, and going on over the next one, fatigue, those go hand in hand. We know that sleep can be interrupted with Parkinson's with the vivid dreaming and movements, and there's a lot of energy use involved in Parkinson's, being very depleted of energy. So exercise can help anyone get a better night's sleep, but I think is especially important with this population. got to keep things moving. Decrease constipation, that is a common experience too, with just overall slowed movement. So of course we want to keep our bodies moving, keeping everything moving, and moving better performance wise, being able to achieve and accomplish those tasks that you want to be able to do, whether it's playing with the grandkids, playing tennis, whatever it is. If you practice anything enough, you will get better at it. Improved drug efficacy. So for those people with Parkinson's who are taking the carbidopa, levodopa, or the Sinemet, it actually does help with the processing of that and helps maximize already that benefit of the synthetic dopamine with the dopamine that you get from exercise. And just going into my last point here, optimizes the dopaminergic system, or that system that uses dopamine in the brain for activation and processing. So fun slide here that Dr. Thakur kind of referred to a little bit earlier was how our brain is activated with medication and exercise. So dopamine is that chemical that's naturally produced in our bodies and is often depleted in those with Parkinson's. So if we look at some of this imaging here, you look at the center brain, how off medication has the least amount of orange spots on there, or the activation areas of the brain. You look to the right with someone who is on that carbidopa, levodopa medication, and you can tell that there is more activation in different areas, in larger areas. And if you look all the way to the left with someone who had just exercised, that has the most orange activated areas of the brain. And you think if you overlap the areas, the brain scans, after exercise and on medication, you would have the largest activation possible. So while medicine is so important for us to be able to optimize our movement, it sets us up for success for the exercise, which is the brain and butter for being bread and butter, brain and butter. I think I'm starting to use here. The bread and butter essentially for being able to optimize them together. It really has the most activation, the most benefits. And if we can move better with medication, we can accomplish more with our exercise. So while medicine is good, exercise is good, you put the two together and unstoppable. Another very, very important point here is that there is a lot of research that is ongoing, and a lot of research right now is showing that exercise slows the progression of Parkinson's. So there's still a lot that we don't know, but we do know that those who exercise compared to those who don't have a much higher quality of life, can move better, maintain their balance, accomplish those tasks that you want to have. So just like your daily dose of medicine, you want to have your daily dose of movement, because exercise right now is the only research proven way to slow the progression. And I want to take a quick movement break here. Like I said, it's going to be joyful today. We're going to have some movement breaks. Feel free to follow along, or you can just watch me do some of these moves here. But I promise it'll be a lot more fun if you participate. So with walking, we're going to actually just stay in our chairs here today so that everyone who wants to participate hopefully can. But just want to start off here with a couple movements. Let me get set up.
Okay, so we really want to emphasize big movements in people with Parkinson's. And what I like to show you is marching in place or walking in place. And we're going to get our knees up really nice and high here, taking some big steps, since Parkinson's tends to make us have these smaller steps. And if you do it enough, you're going to get tired, because as you can tell, I'm having a harder time talking while I'm doing this. But we're really getting our body moving, getting the blood flowing, activating these big movements and reinforcing that. While we're marching, I want to go ahead and add in an arm swing, as big as you possibly can. Now we're getting some coordination involved. I'm doing pretty okay, but if you may get stuck and it's awkward doing the same leg and the same arm, try and switch it up just like you're normally walking here. As we're keeping going, something that is also really, really awesome with Parkinson's and exercise is high intensity. So while we're marching here with our arms and our legs, we're gonna go for a run. I want you to go really fast as you can. Keeping going. 4, 5, 4, 3, 2, and 1. And my heart rate is getting up here. And I'm having a harder time getting my arms and my legs to go together. Another way to make walking fun and more challenging is adding something on top of what you're already doing. So while we are marching here, you can think about naming as many animals as you can think of. I'm going to demonstrate here: alligator, orangutan, zebra, camel. And as you keep going, you may notice my legs are getting a little bit smaller. I'm getting tired, but it's hard to do 2 things at once. And it's really challenging, but hopefully it's fun. Don't feel embarrassed if you only know a couple animals. Practice makes perfect. But oh my gosh, I'm out of breath here. And I hope that you are too if you followed along here. But again, just showing, hey, exercise can be fun. It can be in a chair. It could be in any position you like. And hopefully I still have breath to finish this PowerPoint here. All right, gonna go ahead and share my screen again. So another question, how much should I exercise? So the exercise recommendations for people with Parkinson's, it can be broken down in a couple different ways. The first way to think about it is, I'm gonna put my headphones back on so you can hear me okay. Depends on the intensity. So with moderate intensity exercise, you'd be at 150 minutes per week of aerobic activity or cardiovascular activity. If you break that down, it's about 30 minutes, 5 days out of the week. Now, if you work a little bit harder, like we just did that high intensity running, get into that vigorous intensity exercise, you get a 2-for-1 deal. So it's 75 minutes instead of 150. So every 2 minutes of moderate intensity exercise is 1 minute of vigorous. So very efficient. And this is a goal, it's a recommendation, it's a baseline. But the more that you do, the better. So starting with our cardiovascular activity, it's important that we also have a well-balanced exercise program. Also including strengthening at least 2 to 3 days out of the week. And that is full body, all muscle groups, so arms, legs, chest, back, just like anyone at the gym, but making sure that these are on non-consecutive days, so 48 hours rest break in between, so that way our muscles have time to rest and recover. Also really important for stretching, 2 to 3 days out of the week, but the more that you do, the better. Specifically with Parkinson's, tend to have that kind of stooped posture. So there's specific exercises and stretches for posture. So stretching out some of the muscles to get them a little bit more into alignment. And then lastly, especially for an older population, want to focus on balance at least 2 to 3 days out of the week, if not every day out of the week. I do want to also share that these exercise recommendations that were tailored for people with Parkinson's are actually the same exercise recommendations for anybody off the street with or without Parkinson's. But with Parkinson's, it's especially important that you reach these exercise recommendations, if not exceeding them, because it's that daily dose of movement, just like your medication, because you do have some ability to control the progression of Parkinson's. Another note here on the bottom right here is that we really want to make sure that the exercise is about 10-minute bouts. So you have to be able to do something long enough to get your heart rate pumping. And you have to do things long enough, 2 to 3 months, for it to be maintained over a longer period of time. As you're really working hard to get yourself to a better spot, that takes a lot more of energy and investment. But once you are into a better spot, it's a little bit easier to maintain it. And our hope is that we do see these improvements with exercise in being able to move a little bit easier and faster. So that way it at least balances out the progression of Parkinson's, and you can actually see improvements if that exceeds the rate of progression. So you do have some control on the rate and then the degree that it affects you too. The most common question, I think what you're all really interested to know, is what exercise is the best.
And disclaimer, there is no one right answer. So when someone asks me what exercise is the best, I tell them it's the one that you enjoy and the one that is fun. And there's this great quote here: any exercise you do and enjoy is the one that's right for you. So if you are invested, you're having fun with something, you're way more likely to do it than not. So pulling in the social support, making it an exercise that you don't dread to do. I hate when people drag themselves to the gym, even though they absolutely hate it. So if you don't like the gym, don't go to the gym. Go outside. Maybe you don't even like going outside or at the gym. Maybe you stay at home. Make it an environment that is supportive to your particular needs. And if you do it, you're going to do more of it. And that's where the next point comes in here, is that consistency is really the key. Like we talked about just a minute ago, that if you maintain something for several months at a time, that's where it's going to be a long-lasting benefit. So whatever movement you do, whatever you like to do to get your body moving and staying active, it's really important that you do it regularly. So if you enjoy it, you're going to do it more. The more you do it, the more benefit that you have. Another note that I like to tell patients are that if it doesn't challenge you, it doesn't change you. And so the level that you're pushing yourself is another really important factor. If you're doing something that you can do 100 repetitions of, you could do it in your sleep, you're not breathing harder or anything at all, you're not getting challenged. You're not going to have changes. You get the change when you challenge yourself to do something that you're not super comfortable with, or it's getting you out of breath, because you push your limits and that limit will be higher. And when we keep raising the bar and your limits, that's where the change happens. And those are the results that you're going to want to see. So I do encourage you to push yourself harder than maybe you'd want to. Another really important point is you get as much out of it as what you put into it. So the more time, the more repetitions, the more benefit, the more challenge you're going to have. The greater intensity, the greater the reward. And truly, there is no limit to the benefit of exercise. So there's been some research that shows it is a linear relationship, that the more you exercise, the more benefit and improvement in your quality of life that you do have. So there is no plateau in this. It'll be more limited by fatigue. You can't possibly exercise every hour of the day. So it'll be your own energy level that is limiting the benefit because you can't do it anymore. This is a brief list of some exercises that could be really helpful for people with Parkinson's. I would look at this list, or really anyone, and pick the one that looks fun or that you'd enjoy doing. So walking, maybe there's a walking group, or that's your opportunity to catch up with your son every day or however often. Kayaking can be fantastic for the upper body strengthening, the endurance, the rotation, the big movements that are involved. Tai Chi, yoga, and Pilates, fantastic for stretching and breathing and balance. Boxing's a fun one and has a lot of intensity and rotational movements that are really important for a rigid trunk, because we do often lose some rotation. Swimming, and I love how I'm demonstrating all these exercises to emphasize that you get these great big movements that are really important with people with Parkinson's. Nordic walking, or walking with those trekking poles, helps with an upright posture, taking big steps, arm swings. Cycling can get used to a very high intensity without necessarily having to worry about balance. You're just focused on getting that rotation per minute, your heart rate up. Rowing, fantastic full body exercise. There are chair classes for lots of different reasons, whether that's strengthening or stretching. And this kind of class doesn't always have to be related to Parkinson's either. So I like to tell patients that, hey, sometimes you're tired of Parkinson's. And it's okay to just go and be at any other class or community for any other person. So your entire life does not have to be revolved around Parkinson's if you feel like you kind of need to take a breath and step away from it. Because there are cycling classes for some of our higher level individuals that you would do just great in. Even some of like the stretching or strengthening chair classes. There's people there that don't have Parkinson's, and there can be people there that do have Parkinson's. It's just another form and resource for you to get more movement. YouTube is also a great free resource. You can type in Parkinson's dancing or yoga or anything at all, or it could just be, again, regular chair exercise class. YouTube is free, and that's fantastic because you don't need to spend a lot of money or have a lot of resources to get more movement in. And guaranteed, I could probably come up with a comeback for any excuse that's been given to me at this point. Golfing, especially with all the beautiful golf courses and weather that we have around here, great way to get outdoors, even just for your mental well-being, and the rotational movement of doing a golf swing nice and big. Tennis, or the more popular pickleball, depending on your agility level. Again, you're having fun. You're hopefully hanging out with some other good people in your life to support you through that. Martial arts is another good one for our higher level individuals. Resistance training is that strength training that we were just referring to, in terms of strengthening at least 2 to 3 days out of the week. And that can be with bands, it can be with free weights, or maybe you like some of the equipment at the gym, but even just your own body weight is a really great way to build up the strength. And then just kind of like what we did a little bit ago with having multiple tasks at once, like listing animals and marching or walking, doing a couple physical tasks like walking and chewing gum, or a physical and a cognitive task together, like we were just doing that naming. But that could also be counting or listing, or even just doing a movement and holding a conversation at the same time can be just as challenging. In terms of a Parkinson's focus on exercise, some general concepts and themes here is that we want big exercise. So while Parkinson's kind of leads us to taking these small steps or small handwriting or a small arm swing, we want to fight Parkinson's by doing everything opposite. So we're going to take big steps. We're going to do big arm swings, big punches. Everything needs to be big. Along with that, we get a smaller or a softer voice. And so we want to combat that by doing everything loud. Whether you are counting out or you are shouting because you're having so much fun with exercise and it's so joyful. Clapping, stomping, other great ways to make things big and loud. Intense. Talked a little bit about how vigorous intensity and high intensity is fantastic for people with Parkinson's. Making sure that you're pushing and challenging yourself, whether that's adding some weight, moving faster, doing multiple things at once, or adding in an extra balance challenge. Remember, if it doesn't challenge you, it doesn't change you. So we really want to push yourself to your limits. And then making it fun, kind of like we've been talking about along the way here, is that you're more likely to do something consistently if you're enjoying it. Some particular focused movements are trunk rotation. With Parkinson's, we tend to experience rigidity or a trunk that doesn't move or twist very much. So we want to emphasize twisting motions, whether that is punching or doing kayaking, whatever it is to get things moving easier, because otherwise that stiffness and rigidity can be limiting to our movement. Arm swing is another really great area of focus because with our walking or our gait, your side may not swing very much. So you may have one arm that moves pretty good, but the other one that stays pretty closely to your side. And that arm swing is really important for speed, for taking those bigger steps, for trunk rotation. A lot of different concepts here, in addition to maintaining your balance when you're swinging your arms too. So practicing walking big, like we were just marching, and moving our arms big. Steps Often family members or loved ones always complain, hey, pick up your feet, or why are you shuffling so much? And we want to focus on taking big steps. Some things that we'll try to work on in exercise is walking heel toe. So landing on your heel first, trying to take quick steps too, since it can sometimes be hard to initiate that. And I sound like a broken record, but again, the hardest exercises are the most beneficial exercises. If it doesn't challenge you, it doesn't change you. But I do think that this is really challenging too, because we're going to be least likely to do those hard exercises because we don't feel like we're doing good at them and they push us. It's a lot easier to do the easy exercise, but your potential and capacity for improvement is a lot higher with harder exercises. When we're talking about intense exercise, we have a couple ways to kind of monitor intensity. The most accurate way to monitor intensity is actually blood pressure or heart rate. Blood pressure is not really reasonable when you're exercising and moving. And then heart rate can be hard if you don't have a smartwatch, and holding on to some of those gym equipments, those are not very accurate. I think the easiest way to monitor intensity is by thinking about how hard do you actually think you're working. So there's a couple scales here on the left and the right, but they're essentially the same thing. The one on the right is the original version from 6 to 20, and the one on the left is a modified version from 1 to 10. But essentially, the lower the number, the lower intensity, the higher the number, the higher intensity. So a 10 out of 10 or a 20 out of 20 is you could not do this for more than a few seconds because it's so challenging. And a 1 out of 10 or a 6 out of 20 is I'm resting. You're not doing too much. We want to work from somewhat hard to hard. And so that would be about a 5 to 8 out of 10 or a 13 to 17 out of 20, depending on what scale you're using. And actually, a lot of times these numbers align with our heart rate intensity anyway. But it's really easy for me to do this marching, big walking exercise and say, hey, I'm working at a 3 out of 10. I could probably push myself a little bit harder to get to a 5 out of 10. And also knowing that everyone's 5 out of 10 is going to be different. So while I felt like that exercise I was doing was a 3 out of 10, you might have felt that you were at a 6 out of 10. And that's okay, as long as you're shooting to push yourself into that somewhat hard to hard range. In terms of making the exercise more intense, we've talked about a few of these, but you can go faster by increasing the speed. You can add weight, whether that's actual weights or having bands, and then doing little intervals of all out exercise like we practice as well. A few considerations for exercise on the slide here, starting from the top with medication, if that is something that you are taking, is that it can take about 20 to 30 minutes for the carbidopa, levodopa, Sinemet medication to take its effect. And so just like that brain scan imaging, you want to optimize your movement and prepare to exercise to have the best possible movement, having that medication on board at the same time. So it is helpful for you to take that 30 to 45 minutes before, so it should be all in, loaded, ready to go. And so that way you can be ready to move a lot easier and have more potential to invest in that exercise. So that way you can get more out of it and more benefit. We are promoting joyful exercise, consistent exercise, but above all, of course, we have to think about safety. Ideally, we want people to be able to exercise on their own and independently, but sometimes we may need some supervision, whether that's someone just standing out by or even just talking through or mirroring what's going on. But other ways to think about safety too is just having you set up for success. Maybe there's a chair behind, a table or counter in front, blocking you in so there's no risk of falling. And this is so important because for individuals who have had a fall, it hurts, you don't feel like doing anything, and there's going to be a downtime or a period where you're not able to exercise, and especially don't want to be breaking anything, because that's a really long recovery process where, again, you're not able to exercise. So we'll sometimes see people who are hospitalized for a period of time, or people that have injured themselves and just never got back into the routine. And that's when we see a big difference in their level of function, because they dropped off of that exercise routine. And then wanted to put a note here is that regardless of where you're at, we can make exercise work for you in different positioning. So it doesn't always have to be standing up. It could be sitting, it could be laying on your side, on your stomach, on your back. I do like to avoid the floor since that's hard for people, but if you are doing anything on your side, stomach, or back, trying to do it maybe on a bed, or maybe just avoiding that if you know that that's something that would need assistance or you don't feel comfortable with. So always, you can always say no to exercise that you don't feel safe with, and that's definitely the much smarter choice. So while we are pushing you to work at this high intensity, we also don't want to go too intense where you are significantly sore or tired. It can be common to have soreness after exercise, or some aches and pains, or feeling really tired, but we hope that you would recover in several hours. If you are sore for longer than a day, or just totally knocked out for more than a day, then we need to dial it back a little bit or re-strategize, whether that's taking more rest breaks or maybe changing up what you're doing, because we still want you to live your life. Yes, we want to prioritize exercise, but we also don't want it to limit what you're doing either. Some people with Parkinson's tend to have a difficulty with blood pressure dropping as you are standing up or doing some exercises where you're bending over or moving around quite a bit. So anytime you go to an upright position, your blood pressure may drop a little bit. Having a little bit of awareness of that, and again, having those safety environmental things set up so that way you're not at risk of hurting yourself. And then there's some other strategies to help, like compression socks or stockings or a binder, to help increase that blood pressure so it doesn't drop, you don't get lightheaded, and you don't pass out. I mentioned a little bit, but you do not need any fancy equipment. You don't need that really expensive gym membership. I promise you there is no one specific piece of equipment or particular exercise that will fix you or cure all or be amazing. So I am always cautious of anything that is sold and they're overselling it. If it is an oversell, know that they're in the business to make money, and there are plenty of free resources that do not cost a thing, are available to anybody, where you can still get some good movement in. And we're talking about joyful exercise, prioritizing it being fun. We do want to make sure that this is a positive experience. And some of that is just the way that we're thinking and framing our mind around it. Not dreading to get it done, but looking forward to something that you get to do. Focusing on your abilities rather than, oh, I can't do this. Well, I can do this instead. And just because I can't do it right now doesn't mean that I can't do it in the future. For some people, they like to be around others, and it's great to have that support because there's a lot of great benefit by having a teammate or someone supporting you. But some people like to be alone. So we don't push that. We don't push you having to go in that group class or out in the community. So doing what feels right for you. A quick fun story here is that there's been a lot of great information about cycling and exercise benefits for Parkinson's. And there was a researcher at the Cleveland Clinic who went on this week-long tandem cycling race with a friend who had Parkinson's. And during that week-long bike race, actually the researcher noticed that their friend who had Parkinson's was moving almost like they didn't have Parkinson's. And they were writing postcards back home to family and friends, and their writing looked totally normal. And so this actually brought a lot of great research behind cycling. And there's a lot of great support, community support, and organizations that promote tandem cycling or cycling. But really what came out of it is that what was so beneficial about the cycling was the forced intensity. because the research on the front is pedaling really, really hard. And the friend is also working hard, but maybe a little bit harder than they would like to. And so that forced intensity, that forced exercise is really what was so important in the benefits of exercise. Even if it's not cycling, just whatever you do intensely will really maximize the benefit that you're getting. And another note here is that you don't need a tandem cycle. You don't need a street bike. You could do a bike at the gym, whether that's the upright stationary bike or the bike with a seat, the recumbent bike. And I do have a picture of a pedaler bike at the bottom there, something that you can get pretty cheaply, 20 to 50 bucks, depending on where you get it. And that's easy to place it on the ground wherever you are watching TV and get some extra movement in. But speaking of movement, we're going to do another movement break coming up here because I have been talking too much and you're probably tired of that. So we're going to go with some,
which is a very fun exercise for people, high intensity exercise too. There is the Rock Steady Boxing program, but even if you're not involved in that program, can still get great exercise in, just like we're going to do today, sitting in our chair. So we're going to start out with a jab. This is you sitting in your chair, getting your fight stance. I will say that please do not hit anybody or anything, so a little safety involved there. We are going to be punching and twisting across our body. So you start with your little starting stance. You're going to punch the air. And if you notice, my trunk is twisting, my forearm is twisting, coming around my body. And if I go faster, I punch harder, I'm going to be working even harder. So this is a jab. There is also an uppercut. So we're cutting up across our body. Same position where you start in your kind of fight stance and you cut across your body. And again, I'm getting a good workout. My heart rate's getting up from this as well here too. We also have a cross cut where we come across our body and can get a fantastic workout with the rotation, the big movements. And if you want to make it even harder, you go ahead and you add a kick involved, which you can't see on my screen here, but I promise I'm kicking. And hopefully this is helpful just to kind of break up the talking a little bit and have a little bit of fun with it as well here. But we're going to keep moving forward. Promise I have time for questions at the end here. But a concept that we've talked about is that no one size fits all. So there's no one best exercise. All exercise is the greatest. It's just about what you enjoy.
Also important to target what your experience is too. So what is your goal? Finding out what do you have difficulties with and targeting that. And your physical therapist can help you identify that. So thinking about different symptoms, if you're someone that deals with depression, anxiety, or apathy, exercise can be helpful with that. This is a very high rate in terms of people with Parkinson's experiencing these feelings. And I do want to say that is not just a reaction and the experience of having Parkinson's, but the disease itself. So it's the brain circuitry and the chemistry that has changed. So it's not that these people are being lazy or they don't care. It's just part of the disease. And this can be especially common, especially wearing off of medication if you're due for your next dose. So important to focus on little victories, making it a positive experience again, making it a fun experience, something that you would do as a hobby or leisure time. And exercise helps boost more of that dopamine, which is a happy hormone, in addition to a few others to help manage some of these. In addition to maybe thinking about focusing on some breathing strategies or taking breaks if you just feel very overwhelmed and need to step back. Fatigue is a very common symptom with people with Parkinson's, contributed by some of that emotional turmoil that we just discussed here, but also sometimes medication, and then the sleep that is disturbed in people with Parkinson's with the vivid dreaming and some of the other things that we discussed earlier. In terms of management, of course, exercise can help give you that boost of energy immediately and overall long-term with several months of practice. But thinking about taking lots of rest breaks. So instead of doing 30 minutes all at once, maybe it's 10 minutes, 10 minutes, 10 minutes, and you still got to that 30, and it probably looked a lot better because you gave yourself the chance to rest and recover. We do like our naps, myself included, but we want to make sure that we're not taking too many during the day and they're not too long, really no longer than 20 to 30 minutes, because otherwise you're getting into a whole sleep cycle and then you are affecting your sleep at nighttime. And it's really important just to promote good sleep hygiene too, like you would for a child growing up, to have a bedtime routine, no screen time, relax, calming down, so that way you're preparing yourself to sleep. But I will say that sometimes fatigue in Parkinson's is not always improved by rest either. And so being understanding of that as well. Another common symptom that people experience with Parkinson's is freezing of gait or fog. There's definitely strategies and techniques that you can use. Also, just thinking about preparing yourself and avoidance or prevention in the first sense, that really narrow areas, tight turns, or if you're really stressed or anxious, that's going to make the freezing a lot worse. So you can think about what you can do to be able to get out of those situations, whether it's avoiding all the clutter in your house, or maybe getting the clutter out of the way, taking a big U-turn, and then helping with stress. And so a couple ideas down here at the bottom, 4 S's. If you freeze, you don't want to fight the freeze. So you just stop, smell the coffee, the flowers, shift your weight, and take a big step. Visual and auditory cues can also be helpful, whether it's a line on the ground, like the 4 markers or that laser there, or sometimes auditory cues, left, right, 1, 2, 3, 4, or singing a song like Happy Birthday could actually be helpful. And then in terms of more symptoms, just really quickly here, we talked about fighting Parkinson's with the opposite. So if you're slowed down or you have the bradykinesia, we want to emphasize fast movements. With posture, we want to strengthen the extensors that are weak and then the flexors that are really tight with a stooped posture. Rigidity, we've talked about some rotation, and there's some specific stretches to help your specific needs. If you do happen to have a tremor, weight bearing can be helpful in managing that, and focus tasks like flicking or forced opening and closing. Already talked a little bit about freezing. If you're off balance, we give you some balance exercises that challenge you by making you unsteady. And if you have muscle cramps or dystonia, stretching those tight muscles, and often there is an underlying kind of weakness. I've probably overwhelmed you so much, and you're thinking, all of that sounds great, but I have no idea where to start. So let's talk about that. One, I'm biased because I'm a physical therapist, but your physical therapist is here to help you navigate all that. So you don't need to be an expert after leaving this presentation, or really ever. That's why we are here for you. Pink has this awesome list of resources, which will be available to you with the PowerPoint slides being sent out later on. But there are community fitness professionals who underwent a little bit more training and have more familiarity with Parkinson's. But there are group fitness classes, whether that's unrelated to Parkinson's or related to Parkinson's. Talked a little bit about the Dance for Parkinson's you could find on YouTube or a Google search, and Rock City Boxing puts together a fantastic kind of program. I do want to get a shout out to our occupational and speech therapists who also assign and distribute exercise for various reasons. So for those having difficulty with our activities of daily living, like getting dressed or feeding, or even hobbies like knitting or writing, they can be fantastic to give you some exercise and guidance there. Also, our speech therapists can help with exercise and games and strategies to help with any concerns with speech, swallowing, memory, and more. And then thinking about how can we stay motivated for exercise. Just a few little strategies here is having goals so you can see your progress. Otherwise, it's hard to see day to day, but easier to see when you're looking bird's eye view and can see if you met your goals, whether that's tracking your steps, the time that you exercise, the repetitions, even just a paper and pen exercise log. Having a variety of exercises so you don't get bored with the same routine. We talked a little bit about social support, and my greatest recommendation is if you're not feeling it, start with 10 minutes. By the time you do 10 minutes, if you're still not feeling it, then you can stop. But likely it's just that initial part getting going that is limiting. And once you get 10, you're just going to keep going. So that will help with more movement and feeling better. And then we are going to end here, but I do want to leave you with a couple sayings that will hopefully stick with you. Movement is medicine and motion is lotion, because they are very easy to remember, and hopefully this registers with you that you need to take your daily dose of exercise just like you would your pill, and motion is lotion is just a fun one, helping you move a little bit easier with exercise. But that concludes our presentation for today, and I'm happy to answer any of questions that are in the queue, and I have my email address there as well if anyone is watching at home later on. So thank you so much for listening.
Sabrina, that was awesome. You must be exhausted. You're going to need a nap after that. So good job.
Yes.
Thank you.
Thank you.
We have a couple of questions. We'll start with one from Ralph. What should be the heart rate goal for an 85-year-old history of cardiac disease?
Awesome. Thank you, Ralph, for that question. So heart rate goal is different for everybody based on your age. And this can be quickly calculated online. Your intensity of exercise is based off of a percentage of your maximal heart rate. And your maximal heart rate decreases as you get older. So 220 minus your age is how you generally determine your maximum heart rate. So easier math for me is 80, but 220 minus 80, that would be 140 is your maximum heart rate. And then for intensity of that, moderate intensity is about 50% kind of in there. So you would take half of that as moderate intensity. So in our example, half of 140 is about 70. Of course, you have other things going on like cardiac disease or other comorbidities that we want to be aware of, and just monitoring any symptoms. If you're significantly short of breath or having chest pains, most important thing is listen to your body. But there's a lot of fun calculations that you could focus on with the heart rate. I like to just go off of the intensity of exercise that you're working on, as long as you're not having these other kind of red flag symptoms that pop up.
Next question. I have a big exercise problem. I have PD and understand the importance of regular intense exercise. However, I have severe orthostatic hypotension due to dysautonomia. If I am too active, I spend the next few days in bed. It's hard to know how to find the sweet spot to accommodate both. The irony is I like to exercise and have for decades. Med stockings binder have helped only minimally.
Very good question. And I know, or I just want to say that you're not alone in that. And it can be frustrating because you want to exercise, but sometimes you have these limitations like cardiac disease or orthostatic hypotension. In terms of the orthostatic hypotension, I would say make sure you talk to your medical team. So that way you're not alone in addressing this. Finding some strategies specific to your situation, whether medications do need to be adjusted. It sounds like you may have been using the socks, the compression stockings, and a binder, and the medications not so great. I would say to maybe have a log of the exercise that you're doing, the time, what are you doing? How did you feel afterwards? To try and track your response so that way you can make adjustments each time. But it is hard to find the sweet spot, and it's all going to be about trial and error. You figuring out, did I push too much? And I felt terrible, or hey, I was surprised I could do this kind of exercise a lot easier. Because sometimes people will have a better response to, let's say, swimming versus walking or standing up and down or whatever it is. So seeing how you respond to different kind of exercises. And then if you do have that orthostatic hypotension, you don't necessarily need to be up and down in the chair, or you could do plenty of things sitting down, like a pedaler bike or anything that's safe to do without you worried about getting lightheaded and passing out.
Great, thank you. Ralph, are there ongoing group exercise classes for people with Parkinson's in Roseville?
There are. So I work at Kaiser and we have awesome exercise classes here specific for people with Parkinson's, but also there are ones in the community. In Roseville specifically, right across the street from us is the Roseville Health and Wellness Center. Sometimes there are like senior center or community classes. Again, these wouldn't be particular for people with Parkinson's, but you could still benefit. And then I am a big fan of Rock Steady Boxing. It's not just boxing, it's a whole exercise regimen that has a little bit of boxing, but a lot of just good stretching, strengthening that you need anyway. And you can look that up online, put in your zip code and find your closest facility. But I will say it's been a little hard keeping track of what's still open and going on just with COVID and some things closing, opening up, and just changes here and there. But your physical therapist is a resource for you too.
I have a comment, great presentation from Mandeep. So I agree, Sabrina, thank you so much.
Thank you, Mandeep and Dan.
We don't have any more questions. Is there anything else you'd like to add? Otherwise, we'll go ahead and let everybody go get some movement in.
Yes, please enjoy the outdoors, more movement. I think that's the best way to end this presentation is, hey, we'll give you 5 extra minutes today from this presentation and go out and exercise. Use that for exercise.
I love it. Awesome. All right. Well, thank you everybody for coming. Once again, we'll send all this out to you in a week, probably a week from tomorrow. And thank you so much for coming and have a great day. Take care. Bye.